Well, looks to me like it's 5:30 and I will call this meeting to order. Do we have a quorum, Mary?
Yes, we do.
Okay. Ed, do you want to lead some prayer or an allegiance, pledge allegiance, and then will you lead us in prayer?
Absolutely. What would you like to do? Go ahead and make the pledge, I guess.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Bow your hands. Lord Jesus, I thank you so much for all we're given. I thank you so much for this community we live in and these people here who are participating. And I thank you so much for this hospital. I ask you to bless our time together and this time where we do this business and give us wisdom, give us strength, and help us, Lord, to serve you in all we do. In your name I pray, our Lord Jesus Christ. Amen.
Amen.
Do we have any visitor comments?
Yes, huh?
Would you have a comment?
Yeah.
Welcome.
Okay. Hey, I'll tell you what, I was here before and you
Right.
probably know why I'm here. But I'll tell you what, I got a loving heart, I don't have a green heart. And I see people struggling and I asked you guys for a little chair or something like that. But you know, I'm gonna be honest with you people. I went to the county commissioners at the courthouse. I come here to the county commissioners and you don't have $1 to spare. I mean, really, I think it's really damn good. I live out by the state line 9 miles, and I'll tell you what, I bet you there's 40 of them out there that live there that are paying taxes, and they won't do nothing out there. And them people behind the Powder River out here, they don't get nothing. No roads, no nothing. And what are you guys, I asked them, what are you guys doing with our money? We should have a hell of a banking account here. I mean, I don't have no kids for school. I don't care if you even have a school. I paid $9,000 and some dollars a year out for the school. And I told them I'm going to go play basketball one of these days when I can walk and run. And they said, no, you can't. I said, I'm going to go in there and they'll have a cop take me out, but I'm going to tell him, let's quit this shit right now. I'm the type of guy, I love people. I'll help anybody, and I have in my life. I gave more away probably as much as I almost made. But I'll tell you what, you guys, I don't know what good is the county. The county ain't good. Just like me, and like I told you before, when I got hurt, they turned me away. Now, there was a guy just here a week or so ago. He walked out behind me because I had therapy, and he walked out of the hospital. And this, I don't know if it's true or it's false, but he got there and he was mad. And I said, well, what's going on? And he says, you know what? He said, I spent almost 2 hours in there fighting with them people. He said, my wife fell off a horse and broke her back and was bleeding. And he said, I called the hospital and they said, don't bring her here. So he said, I took her to Gillette. And I said, what? And I told him about my incident. And he said, oh, I can believe that. But you know, I'm going to be honest with you people. I know a hell of a lot of people in this town. I got people when somebody did something to me once. He come out of the woodwork and was going to take care of him. And I said, no, God will do that. But I'll tell you what, I know a heck of a lot of people. They all are asking me, how you doing on your chair? How are you doing on this? And how are you doing on that? I said, I don't think the county can afford it. I said, they take all the money in, and I'm the type of guy that I think the company of your guys's, and I know you can only do so much, I don't care what anybody says, but I think that there's lots and lots of people that are related to Joe Biden and Kamala Harris. They take from you, but won't give you a darn dime. I don't think you guys could even buy me a pair of shoes. They would turn it down.
So, just a quick thing. So, on the chair note, I don't think it's so much a money thing. But most of the time, most physical therapists that I've been around, they don't want you to use the lift chairs because they want you to learn to get out.
Yeah,
without-
what I meant when they come in and sit down.
Right, and
Then
so,
they sit there and then
right,
you know,
but they.
hell, that lift chair was there. Get right up. That's what I'm after. No, not in there. But I talked to Mike. And he said, I don't know, nobody's ever let me know about it. But the way they talk, they take one. But I'm not saying they would.
I don't know, but
I think it's stupid. And then they asked me, you know what they asked me the other day, some of the people? Well, why don't we put a spa out there on the lawn? And we could get in there with our backs and our aches and pains and stuff. And I said, hell, you can't get a chair out of them. How are you going to get a spa out there to sit in? And you know, it would be nice. My brother lives in Gillette, and he says, they got everything up there. He says, hell, it's just like uptown. And I said, I know it's bigger in Newcastle, but I'm type of guy that I want to be fair. And I'm a fair guy. And I help everybody, and I don't charge anybody. But I'll tell you this, it makes me mad when I see that they raise my taxes $200-300 more, and we're getting shit. And where does it go? And this ain't for you guys. This is different. But I talked to the counties up there, and they said, no, we don't go with the big wheels and this and that stuff. You don't believe them. Because I tell you, I drove out on roads, and I drove up to there. They got good damn roads. Good gravel roads. But the other ones that are peons, no, I was driving like I was drunk. The guy said he called in one day to the county to play their roads. He says, man, it's getting so rough. And I said, yeah, I needed me drive out there and look at it. And I did. I said, oh man, this is the difference from the big wheels up north by Beaver Creek than it is out here or anything. But you guys, nobody will want to do anything for us. There's not a damn one that'll do anything. And then they told me at the courthouse, if you got a petition out, so Trish and Mark did, and most of them wanted it, nope, they threw her out the door. They lie to you. And that's what makes me mad. I mean, the damn bastards, I don't care. I'm not, excuse my language, but I'll tell you what, when I get disgusted, but one thing I know I can do, and I got them on a table. When I'm out there graveling that road, I can put big piles up there, and they can't get in. So if you got emergency out there, you might not get your butts in there, because I'm not going to baby you, and I'm not going to. And when I move snow, I'm going to pile her up, and I might move it tomorrow, and I might move it later on. As I got them over a barrel on that shit. But they said, no, we can do whatever we want out there. And I said, no, you ain't. I said, when I gravel that road like we do, and we take care of it, we're the boss, not you. And I meant that. But I shouldn't be saying things. But I tell you what, I'm really disgusted over our county. I never been in a situation like this. They're goofy.
So go ahead, Wayne.
What can the hospital, not the county, the hospital board help you with?
Well, what I've tried to do is get a little something for the old people. And that's all I am. Even like me, when I come in.
Like 1, 2, 3, like what do you got in mind?
Well, what I wanted, they thought of a lift chair would be good. When I first come in here, I couldn't even get up. I'll tell you what, I had a struggle. They had to help me get up.
Well,
And that's why I got one at home.
and
lift
besides
chair.
anything besides the lift chair that's important.
Well, and then the spa, one of the two. But what would be wrong with a little spa out there where a guy could go in there and just, you know how you get massage, you know? So, but I mean, you can only do so much. I understand that.
No,
But
I just wanted you to be
look at all
clear.
the people
Thanks.
don't get nothing out of it.
All right.
That's what pisses me off. I mean, I shouldn't be saying things probably. I'm sorry. But by God, you know, when a guy gets you get a little tired dishing out money every year, going up every year, going up and up. And what's bad about it is the big wheels get their ways. If the county don't want it, the city don't want it. If the city wants it, the county don't want it. This town should grow a little bit. I mean, that's just the way Newcastle is. I'm not behind you. We need some people to come in. I liked it when I moved out here in '78. That was just the right size. Main Street was going on, the lamplighter, everything was going on. I'd like to see it come back a little bit, and then it would help us from paying so many taxes.
Right, but for the board, you give
Yeah.
us 2 suggestions you want considered. We can't help you with the roads, although we drive the same roads.
No, I know, you can't. This is different.
Thank you.
Yeah. But I mean, everything I go to do to the county, they lie to me. And I don't like to be lied to. I like to be the truth, and I'll tell people.
So can I tell you the truth and then we've got to move on?
Okay,
So the truth is, I do not think we're going to get a lift chair.
that's
From what
all
I
right.
understand. But, and we are, as a hospital, we are trying to do the very best we can with the county's money and with the taxes that you guys give us.
Yeah.
And we do appreciate it. And like I said, we are just trying to do the best we can with those taxes that you guys are sending our way. And I'm sorry that we're not gonna get a lift chair.
Well, that's all right. At least I know.
Sure.
And I don't really care.
Okay.
Cause you people, I knew that was a lot of people told me you ain't gonna get one, and they were right.
And I will tell you, it's the reason why is because most instances of physical therapy, they want people to do the work of
Right.
picking themselves up. And that way they can use their arm muscles and they can use their leg muscles.
Yeah,
And so it does not fit.
but when you gotta go help them up, that's
Then
kind of
that's
the
okay.
shits.
That's okay, because
That's part of physical.
That's all right.
there.
Well, at least I
So,
said my thing
Right.
anyway,
and
Yes,
we
you
do
did.
appreciate
But-
that.
but I know better to ever come back. Cause I know you guys will never do anything. And I don't think anything's gonna ever change. And I told them no more helicopters. If I die on the way, I'll die on the way. But that was $80,000, that damn thing. And that ain't no more, no. I wish when I run over myself, I wish I'd have just gone. Cause this world is just a sick world. But you guys go pray to your devils, and that's what I want the county to do. I'll tell you what, that's enough of that shit.
I'll take care of it.
Yeah.
The therapist won't let us have a lift chair in there, so they won't.
You don't use lift chairs.
You know,
They don't.
they don't even do it if they're at home, they tell them to stay out of them, so. But he doesn't understand, so I feel bad for him.
Okay. He wants to come back with something more realistic, like,
Right.
flowers in the nurse's station. We couldn't even do that.
Okay.
Well,
Any more comments?
maybe I'll put one of those in my office, and then if he needs a place to live, it won't upset PT because it's in there with me, so. I guess I feel bad for the guy, but we can't fix that.
Okay, let's move on.
Okay, thank you.
Or I need a lift chair.
You might need one. Okay. Okay. The minutes. Do you have any, before we approve the minutes, do we have anything we need to, I did get one change to,
I
do you
have
have any other? Yes.
4 items. Don't know if any of them are important, but on page 2, under strategic initiatives, manner. At the end of it, it just looked to me like the last sentence, like something's missing. Shane,
Well,
final accepted job operating VP operations for whom?
where are you looking?
Oh, right here. As operating.
Operations for
I'm in
some
operating
company or?
operation.
For Nebraska company, isn't it? Nebraska and Wyoming is what I have.
Well, that, he's got territory in both, but for what company is he doing it?
Who's that?
As Shane.
Well, then,
Oh, the company, he didn't ever give us the name, actually. It's a new organization and I don't know. Which they don't.
okay, well, then
tell
I
us.
understand why that English is the way it is. Down on page 2, under finance, CEO report, additional, see attached. My question is the attachment part of the minutes of the meeting?
Yes.
Okay, so that's good. Page 3, up at the top, very top line. I think the on is missing.
They're not.
Well, I like to say unable, but you can say not able.
Yep, that works. Yeah.
One of them will do. And then, on page 3,
What's a not in, so don't do
What?
both.
under foundation,
I took the others.
Not unable.
where it says break, it just seems silly to me to call it a 5-minute break when it's got 8 minutes elapsed time.
Oh,
What is it, just a break?
Okay.
Agreed.
that works. Yep.
I didn't think they were earth-shaking points.
Okay, good job.
But you can add, right?
I like it. That's specific.
Anything else for the minutes? Okay, so are we ready to approve them as somebody wants to make a motion to approve the minutes as
Amended.
I move to approve the minutes as amended.
I'll second that.
Any discussion?
I'm not voting on it.
Okay.
I wasn't here, so I don't know what was discussed.
Okay, any other discussion? Okay, all those in favor of approving the minutes, say aye.
Aye.
All those opposed, say no. Okay, the minutes have been approved. And that's eight. Oh, with one abstention. Yep. Okay, and, Rob, we have any additions or changes to the agenda?
Yes, Madam Chair, I would ask that we would look at Health Stream proposal for, we had a 5-year contract that's renewing.
What was that? Yeah.
Health Stream.
So we'll probably do that under the CEO report. Yeah, under the CEO report, please. Is there anything else, any other additions or changes to the agenda? You got it. It's all covered. Sure. This is only one. Okay, so I'd entertain a motion to approve the agenda.
Second.
Okay, all those in favor of approving the agenda, say aye.
Aye.
All those opposed, same. Okay, so the agenda has been approved. Okay, okay, so we're up to Polly.
Polly and Kim.
Hello, everyone. My name is Polly. I'm your infection control and employee health nurse, and I'm also assuming the interim quality director title here soon. Been working with Kim quite a bit the last few weeks, trying to learn her role as well as trying to keep my infection control rolling. So I'm going to go over the quality committee meetings that we had on October 8th. For the department reports for infection control, which is my department, I'm working on reducing workers' comp cases. Currently, I'm seeing an increase in cases. I don't understand why that's really happening, but there is a slight bump in the cases. I am providing injury-specific education after each incident, so I'm trying to train the employees how to prevent these in the future. We have had some repeat employees do kind of the same thing, whether it be like an exposure or whatever. So I'm trying to provide them with education to, kind of tell them, okay, not do this again. So I'm trying to do that after each incident. We have a total year to date of 11 injuries for this year, 2025, compared to 8 for the whole year last year. So we have a little bit of a bump, and we still have a couple months left in the year. So hopefully those numbers will stay stable and not rise, and we can get through December with no more injuries, but I can't guarantee that. Donalda, in acute care, with her PI project states she's having roadblocks on her medication education. Her staff still believes she's going to provide the education to these patients instead of auditing to make sure that the education has been done. So she's seeing a little bit of difficulty there. She would like to work on the discharge vital signs. That is something that's kind of important for carrying out the charts. Her goal is 50% and to gradually increase. She states that she will complete chart audits daily to look for compliance, and she'd also like to ensure that oxygen saturations are being completed on all infusions and admits. Her goal is 30% in 3 months. She will look at adding the task onto the Epic brain. That's what we call it as nursing. We can see what all the tasks are. And then home health, Heather added a questionnaire to her HH CAPS. She is also educating patients that they need to be answering the survey when it comes. Kim will reach out to Gina with the HH CAPS to get a sample so she can show her patients what it should look like. And then radiology was not present at the quality meeting, and there were no concerns noted by the medical staff that was represented that day. In other business, we did discuss that some of the nurses had been blocking nursing notes in the patient charts, and this cannot continue to happen, as patients must be able to see all of their notes that are entered in the chart, unless it falls under, some of the exceptions, which would be like a sexual assault or something like that. So patients have the right to see all of their notes. And then no board members were present due to board training. And then I am just for my and Kim's quality, I'm just continuing to train with her and learn. If you have questions, ask me. If I don't know it, I'll get it from the experts.
Very good. Any questions for Paul? Thank you.
Thank you. Thank you very much.
And thanks for stepping up and giving it a go.
Yeah.
Doing both.
Thank you. Yeah.
Thank you. Okay. Mary, did you guys with not being there, you don't, yeah.
I haven't seen, yeah.
Okay, so Kim, you're up for Manor.
So we do have some credentialing that we do have to go over, so I'll just quickly touch on that.
Okay.
We have Dr. Danish with Blue Sky Neurology. He's reappointment. Dr. Kinsman, Dr. Plunkett, and Dr. Brinkall of Dakota Radiology, they're reappointments as well. Dr. Durso, he's cardiology, also a reappointment. And then we do have an initial Dr. Trotter. She does flights over at the Manor. Nothing concerning in any of their charts for you guys. Moving on to the Manor. We do have a census of 52. We did have a gentleman pass away this afternoon, unfortunately. So that puts us about a 90% occupancy rate. We are 3 stars on our 5-star report. Something with our staffing metric didn't get converted over properly, so the next time we upload it in November, it should be the proper, and we should get that 4th star by then.
No, but the 3 has gone up then too, because we are at 2.
Staffing, and now we're at a 3, so it was just a matter of fixing that reporting mechanism so that it was capturing properly. On Monday, one of our residents that was Medicaid pending was approved for Medicaid, so that's good. They're going to back pay us. We have 19 private pay. 4 of those are Medicaid pending, 2 VA, and then 31 Medicaid. We have 4 pending referrals. Our state survey has been kind of put on hold with this government shutdown. They're not able to do anything federal, and a lot of our tags and stuff are federal regulations, so they're not able to do that. We have 10 contract CNAs, 1 RN coming. We did have 1 night shift CNA start, that's our own, and then 2 potential coming for night shift. 1 is going through the licensing process, and then the other just needs to test before she can start. And then we do have another CNA application that we just received this week, so we've got to get her on the schedule for an interview, so hopefully she'll come aboard. And then we do have a unit scheduler position open, and we've had 3 applicants so far for that, so we've got them on the docket to interview next week. So Good things are coming.
So the 10 contract CNAs, does that mean they're travelers or does that
Yeah,
mean?
the travelers, yeah,
Okay.
yeah. So we're hoping with the 3 full-time night shifts coming on that we can shift some of our night shift CNAs.
Traveler CNAs, yeah.
Yes, yes.
Is the RN a contact?
Yes. And then we do have 1 full-time RN who's gonna be coming back, but she won't be here until the middle of November, but she is scheduled to come back this fall, so that should help us out. Any question?
Oh, thank you.
Thank you for stepping up too.
Yeah, you're welcome.
They're doing a great job, all of them. Everybody's doing some kind of step up, so.
Okay, so now it's on to you, Tricia.
Well,
Okay, so tell me,
it's Tris.
Tris,
That's fine.
Trissa.
I answer to just about anything.
Okay. I just want, so is that how you spell it? TRISA?
Yes, ma'am.
Okay, okay, I will put that in my brain.
This month I broke down, the Upton Clinic and the Newcastle Clinic, which you can see. The Upton Clinic had 53 patients and the Newcastle Clinic had 564.
Okay, so where do I find that?
Here at the bottom, on the very bottom, it'll
Oh,
tell
my goodness.
this, yeah, sorry. We'll work on our reports a little bit better. We're following about that.
This is an epic thing.
It is,
Yeah.
it is, but we'll get it so we can, view it a little bit easier. The patient volumes for the month of January through September of last year to this year, we show an increase of 2,825 patients. Even though our patient volumes were down this month, that is a good thing overall. We're gonna start to track that from year to year, month to month, just to be able to see the influxes and to be able to accommodate both peaks and valleys over the years. Typically, when school starts back, we see a really big drop, but flu season is the longest, so it's just a matter of time. We did see last week alone 168 patients. We gave away our very first drawing of our earbuds for the breast cancer awareness, which was really nice. Tomorrow will be our second drawing, and it was being really well received. We did have our new provider, Kelly Randerman, who is a family nurse practitioner, start on this. She is up and seeing patients and doing an amazing job. And today was our very first transfer of patient care from a competitor in town. And so we were very excited about that. And it's, even if it's not, we're with it.
Too, because there was a baby involved.
That's true. That's true. I understand.
You cannot fix Washington, D.C. from within Washington, D.C. You have to fix it from the outside. It has to be citizen uprising. And the only way you can do it is through an Article 5 convention. There are lots of other ideas that people throw out there that aren't in the Constitution necessarily. This is a peaceful, legal, constitutional method for reining in the federal government, which, like I said earlier, is the responsibility of the states. That's one of their roles, and they've abdicated that responsibility horribly. Our founders would be appalled that we're thinking of solutions other than an Article 5 convention, because that's the process they put in for this purpose.
I've made copies of what the clinic has been, as Kathy says, exuberantly decorated. Yes, we are having a lot of fun with the month of October. We have decorated, we do have, the preschool is coming. Next, the 29th, we do have about 12 children coming from the Children's Center to trick or treat. We have special bags for them. We also have other things for the children when they come in that they can choose from. Just trying to make them feel a little bit more comfortable. We did move our checkout desk, just so that you know, to capture all the patients that are supposed to be rechecked. It's working out really well. The doctors
Where
are.
did you put it?
So it's just around the corner. So as you come through the door, it's just right there. So as the nurses are walking the patients out, they're stopping at that checkout desk and catching if we want to see them again in 2 weeks. Do we want to follow up in another appointment? So, we're trying to have more consistency in our scheduling instead of we don't have any appointments available and you're supposed to be seen. And it's working out really well. It's being well received. And then on our days that we're really busy, if we see more than 2 patients walking the door, we're bringing them back and registering so they're not waiting and having a violation of HIPAA. We do have our sanitation station, thanks to Polly, to have people that are sick wear masks and or that they're washing their hands as they come in. We are still holding a few bills for Dr. McCarty for some enrollment, which we're working through with Innova, and we're just waiting for some updates on that. We are currently holding staff meetings, which has never been done over there, so that's been a fun thing to keep everybody appraised. I think that I communicate way too much. But Amanda and I are also going to go through some super user training so that we can take that off of Kim's docket so that she can concentrate on the manor. We have received a bid for the removal of the dead trees, and that was supposed to start today. I was hoping to give you an update, but we're grateful for the rain. And so we'll just have to wait. We did give additional training to Dr. McCarty and to Kelly Randerman on Monday, and we set up some additional templates for them to be a little bit more successful. And let's see. I think that's all.
What about the number of visits you had in 1 week?
I know, 168. We're really proud of that. So I think that what we're trying to do is working, and our good positiveness is coming out into the community. So I think you can feel it if you come over there. Everybody seems to be communicating and happy. Mindy's last day full time was today, and we had a little bit of a celebration for her. And so, but she's going to stay on with us part time. I don't plan on replacing that position right now. I want to absorb it just to see what our numbers do. We have had quite a few people scheduling in the Upton clinic, and so the plan is since I do have 3 people in the business office, the days that it's heavy, we will send one of those people in a carpool, so we're not spending more money, to that clinic to be able to provide patient check-in and check-out. So we're just kind of transferring some things around. It's all still fluid, just trying to make do with what I have.
Awesome.
Yeah.
Thank you.
Do you guys have any questions?
I
Ted?
congratulate you on your work. Your tree removal is the individual company or whoever's removing the tree, are they licensed or do they have insurance, I
They
guess?
do. It is Sean Crabtree,
Okay.
local here, and so we're keeping that funds in our community. And Carrie Drost and her family have graciously donated the rock. So I don't know if we'll get that down this fall, but I'd really like to get some of those dead limbs out. Even today, we had some very large limbs fall because of the wind last night.
Sure.
And so their plan is right now is to remove, there's a bench in the front. They're gonna clean up that area. We thought that we could beautify that with something. We're just not quite sure yet. And they're gonna draw a line with the hedge, the Fitzers, and make those into a square. And then everything else that is dead will to show that there's 3 trees that need to be completely removed. Their plan is that they will completely take those out and haul them to the recycling to be chipped to use as mulch. And then they plan on just trimming up what's there. They're not going to take out everything. They're basically going to make it look better. And then once we do that, probably just get some slowly start to put maybe some fabric down and get some rocks in there and then make it look a little nicer. So
Thank
yeah.
you.
You're welcome.
Joshua has insurance.
Josh is very excited to help you. I'm not quite sure that, yes, he keeps on telling me, Ted, choose what color. And I said, well, just bring me rock, Josh. Okay. So yeah, we're excited about it. I think it's going to make a huge difference on the appearance of it.
I made her wait a whole day before I said yes to $5,000. I just want you to know.
I'm sweaty.
Anything else? Any other questions? Thank you for your work and all the progress. Good. Okay, so now we're up to you, Rebecca.
Well, my
You've
first
been here a
report,
month now.
I have, I know, I just was thinking that yesterday, it's been a month.
It's been a good month,
Oh, good.
honestly. So I won't bore you with reading verbatim because I know you have a copy, but I will just open with, how happy I am to be here, and I feel really good about the month, that I've had. And all transparency, it's been a lot of deep conversations with our employees and managers. And, I don't claim myself to be a hero by saying this, but these were some people that really needed support, and they felt like, and that's not reflective of the team here, but I think HR just did for the service in the past. And so, I'm really happy with where we are in that, and I feel good about that. And honestly, I really like the psychology stuff, so talking to people and working through problems is where I'm happiest. So, I had an open spot on my team because Rainey was gone, and so I have filled it, and thankfully with an internal candidate, because that's what we should be doing. We should be growing our people and giving them opportunity. And so Dawn is coming to us from activities, and she was hiring her HR experience. She had about 17 years with the state of South Dakota.
Oh my goodness.
So it's been a few
Anybody
years,
know?
maybe 5. I was pleasantly surprised, and so I'm sure it'll take her a little bit of time because she hasn't, technology and things have changed, but I'm excited about that. So one of the things, I'm identifying different things, and so a couple of things I mentioned here in this report is we've got some issues with things being delegated up to Kathy that we both have since worked through, but there's some training gaps there that I need to work through. HR should always be managing up. It's not our business necessarily to handle everything. And when we have risk management issues, those need to go to Kathy. So we can sort through them. And so there was a lot of things we're finding where, well, no one told me that. And so that's a problem. So another thing is, basic employment law things I'm finding, very deficient. And so it's not a punishment. I need to assess them. So that's what I'm doing. I was originally trying to find something that I could just online. You think you find something, right? It's 2025. There wasn't anything. So I'm going to create my own assessment so we can figure out where that level is. So one of my goals for Q1 2026 is hopefully we start our I-9 audit. I would like to have done it sooner. It's one of the first things I like to do, but it's just not been possible. So I've been led to believe there might be quite a few deficiencies there. So we need to solve this as soon as possible. Long-term initiatives I'd like to do, compensation study. Kathy and I discussed, that's been something she's thought about. And some leadership training development and succession planning is important. So I have given you one thing that Gallagher has given us. I'm just telling you now. I gave it to you because I'm transparent. It's not my decision to make for you, but it is not something Kathy and I was proposing to even remotely consider. I think it would damage the culture further, and I think we might have some turnover and retention issues and recruitment problems if we even went that route. But then it's your business to say that. So I did find it fascinating. I won't lie. Medical plan. Obviously, you're going to go. It's money saving, but we don't get to track of that. So Gallagher's behind in getting us rates, so I don't have them for you. I think our open enrollment starts the 10th. Our next meeting is after the 10th, I believe. So I don't know how we're going to do that. That would require us to have a special meeting to talk about.
Yep, we'll do it. We'll have to do that open enrollment late.
Okay.
Yeah.
But I should be November 1st.
Are you guys looking at different alternatives than our current Blue Cross?
We are
funded?
we are not getting presented with where Gallagher's basically telling us that they can't find anybody that will either A, take us on because of our risk pool size, or B, that they're too expensive for us. So we're not real hopeful this year that we're going to be able to make a switch up, because for one, I think, I won't say, but I think that there may be some opportunity for us to look at whether we want a different management company helping us, because really they've kind of boxed us in. And so Yeah. The only other thing is that I think I can't remember the name of the type of policy. It's not stop loss, but it's something like that. That I heard that you can basically get a vendor that will help you be able to just have a steady amount of money that you can put across the months, and then you kind of shore it up at the end of the year so that they'll help cover those gaps so that we don't have these big rise in bills. But I don't have that accomplished yet. I just learned about it, so I'm going to see what I can do with that so that we don't have, I mean, those $225,000 and $250,000 bills in a month. There's just killers for us. So hopefully we'll have something back in a month or so on that.
Yeah, I understand that. In my experience in HR, I've never seen us not have rates by now. I mean, I've always had them for an open enrollment, beginning January 1, like August sometimes. So, but I realize I'm in a new place, and so I understand that. But I wasn't pleased because when the presentation came for Hannah and I, it was all about focusing on that plan in front of you and didn't give me the full picture. I just want someone to give me the data. I don't want, it was like a staff report of 2 hours and it didn't really tell me anything. I just want to see the numbers and I don't want them to decide for us. So we wanted to see every option we had and we didn't get that.
And they get a pretty good administrative fee, so we need them to work for us.
Ken had a question.
Maybe a silly question, but does state of Wyoming have an insurance pool and would we qualify? Government officials. And
They do have, but I don't think that employers of our size qualify for it.
So Chip was, I don't think it's works right now, but Chip was talking about wanting to get it so the hospitals could be part.
I know, I
That would be
believe
good.
Dottie would maybe know, the schools belong to that, don't they? The county belongs to that.
Right.
I didn't know whether hospitals would qualify or not, and I don't know if that's even a
Well,
option.
we can certainly ask them, but the way I've understood it is we haven't been able to because of our.
Right, and that's what Chip was saying, that the hospitals weren't able to, but he thought that it would be good if they could.
It was one of those things that when he was talking about things that, like proposed legislation that could help rural health.
I just knew the state of Wyoming did that and included the schools so they could, trying to make a bigger pool. And if that's our problem, a little pool,
Yeah, well,
maybe a bigger, small fish jumping into a bigger pool.
You mean
Well, I'll
pool
start-
together?
Pool together.
Well, and then there was a person, I think, maybe you know this person's name, but the name is Alex Starr. She came in really late and gave me this proposal that they were gonna try to get all the different Newcastle people together to try to put an insurance pool together for the county. But the stuff that they all typically want to be able to look at their risk pool and do that stuff, there's a lot of data that's required for it. I don't see us pulling that off by the time January hits. So, I don't know why she started so late. She really should have started on that much earlier for her to get that done. Maybe she's hoping, maybe she's gonna realize or something that she needs to look at that more for another year away.
Yeah, that's
So-
me starting to work on it for 2 years,
Yeah, exactly. So,
I just had a comment, if I may. I really liked and appreciated what you wrote under why this is important. Knowledgeable and well-aligned HR team is essential. And I loved the order that you put it in. Protect the organization, support the employees, and maintain compliance. I really like that.
oh, thank you very much. She's done a great job. She's had a lot of, I don't know, problems, but she's been doing a great job.
Something the county would find it.
Another very gentle request is, could we have you sign the report?
Absolutely.
That is up to you. I just, in the future, to go ahead and look back at the report and know exactly where it comes from, but it's not dated.
my signature.
That's right.
It's not, well, really not dated or anything like that, so to know where this report may have originated would be important too, so.
Yeah, she created it on her own, did a great job.
Yeah, I agree, and I would like to, that small change.
Anything else for Rebecca? Okay. Okay. Well, should we move on to the finance committee reports? Does Tish want to start?
Tish is on there, yeah.
We have Carrie up first. Do we want her to go first since she's first on the agenda?
I
Or
think,
would you rather wait?
yeah, Tish can go through.
Go ahead, Tish,
Can't present
we can
that.
let you present.
She just posted that her mic isn't working or she can't
She's
hear.
unable to hear the meeting.
Yeah. So you might come back to her.
I can't hear the meeting. My microphone has quit working. Okay.
So what do we do?
This is a new challenge.
Yeah.
I know what we can do. I'll call her.
All right, yeah.
I'm gonna have to learn how to do different things now, so.
We've done the telephone thing on, the table before, so.
Yeah.
Hey there, how are you? I keep
Fine,
texting
thank you.
you.
Yeah, well, we didn't see your text, so I've got you on speaker now, and you can go ahead and go through the finances if you'd like.
Sure, absolutely. Thank you so much for doing that. The microphone crackled and died about 5 minutes into the meeting, so I apologize.
Hold on.
Put that on hold, or we can't because we're recording.
Right.
There's an echo. Can you put your microphone on, turn it off, Tish, because you're echoing. Thank you.
How about that?
That's much better. Okay.
Thank you.
Okay. Sorry, I apologize. So, first of all, we went over the narrative with the financial reports. We had really good months in the month of September. The net income was better than budget, so we had a gain of $118,000, which is much better than last year or last month. Newcastle Clinic was worse than budget. So they had a negative $23,000 versus a budget of $42,000. And Trissa feels that she found the reason for that, which is great news. Upton Clinic was better than budget. They had a gain of $2,058 versus a budgeted loss of $186,000. The specialty clinic was slightly.
I said $186.
Oh, I'm sorry, $86.25. The specialty clinic income was slightly worse than budget. They had $32,000 actual versus a budget of $34,000. The gross patient revenue was better than budget. The gross patient revenue was $2,591,000.
Can we stop there for a second, Tish?
Tish?
I'm sorry, what?
Ben had a quick question.
I'm not sure if you can hear me, but I'm a little confused looking at the cash flow. It shows total inflows of 1.9.
We're not on the cash flow.
Yeah, but I know, but
okay.
But isn't that the gross patient revenue of 2.5?
No.
So gross patient revenue is not on the cash. Am I misunderstanding you?
Yeah, it has the money market totals in there as well as the not
Could
just
I-
the revenue.
Could I answer?
Yes, please.
So she's talking about revenue numbers. The cash flow is cash collected numbers. So when
Okay.
Tish says that
Well,
you're correct in that when you're saying that, or when Tish said we had a great month, we had a great revenue month, we had a terrible collection.
Yeah, this is where
So you are correct.
This is where I'm missing it, yes. So we made lots of money, we just haven't collected it.
Correct.
Got it.
I'm not sure how that counts as making it if you
Well, that's where I'm having a problem.
But we'll get back.
That's the way
Sorry.
healthcare does things, so.
You're back up,
Common
Tish.
sense, Ben.
Oh, yeah, never mind. Thank you, I'm sorry.
Thank you, Carrie, for answering that question for me. I forgot where I was. Deductions. So deductions from revenue were better than budget, which means we actually wrote off less for contractuals. We had 805,000 for actual versus a budgeted of 808,000. So we were close, but we were able to keep it under budget. Operational revenue, as far as the retail pharmacies go, they were still worse than budget. They had 473,000 actual versus a budgeted of 546,000. Total expenses for the month were better than budget, which is a good thing. It was 2.2 million actual versus a 2.4 million budgeted. So we are continuing to keep expenses down, which is good. We received $2,000 for the in-home services grant. That came from the city. They have a grant that they get in addition to the state grant. We took in donations for the CT project of 40,000. We had miscellaneous revenue. We had travelers that paid rent for the use of their home that we allow them to stay in of $750. We had specialty clinic miscellaneance rent. That's their rent. That's the providers that work at the specialty clinic. They pay us rent for the $1,201.92. We received a refund from Bayer. We originally ordered a piece, a part for the new CT, which were the injectors. Keisha found out that it wasn't going to work the way that she wanted it to. They went and ordered a different model, and we actually got money back. So we had originally spent $34,000, and we received a refund back of $2,400. Keisha also sold the injectors that she had that they used with the old CT because the new CT will use new ones. And she saw $600 from the sale of those injectors. We put that toward our total donations for the CT. We received $31,872 for the mill levy. And we had meal income, which is both employee and guest, for the month of $1,103.50. We had interest income. This is interest that the bank pays us for the money that we have on deposit, to the tune of $7,521.56. We also have interest expense. The interest expense from the bonds is consistent. It's a flat monthly rate. It's $4,311.47. We also have the Parada loan, which is the pill packaging equipment that the pharmacy uses, and some additional late fees of $2,331.25. So we had a good month revenue wise. The problem is we didn't collect all of the revenue. That revenue collection will run over the next 60 days. Medicare will pay in 14 days, but other payers have up to 60 days before they typically pay us, as long as the claims are going out the door in an efficient and timely. Does that help with the explanation of revenue is future cash and cash collection is on past revenue?
So
Does that make sense?
Yes.
yeah. So Tish, this might be, I'm gonna stop you for just a minute to ask. It seems like this might be a good break spot to ask if there's any questions. Would you agree with that? Anyway, do any of you guys have any questions before we start on the balance sheet stuff?
Well, I guess, is this the right time to talk about improving why we're not getting?
No, that's what the cash sheet, we needed to.
We'll talk about that one.
Why we're not receiving, okay. All right, I'll wait.
And then I have a quick question, Tish, where on the total expenses per month was better, than budget. How are our account payables? Are we up to date on those?
We are not. We are ranging anywhere between 45 and 61 days on our accounts payable.
Okay.
We have and continue to pay all the vendors over the course of the 30 days. We have a 30-day lag in there. And we just booked 2 rather large invoices from the state of Wyoming that we need to pay next month by the 14th in order to keep participating in the quarterly gap payments that we get. So we have to pay half of what they're going to pay. So they double pay us back. So we have to pay that by November. So that bumped up our accounts payable to 1.4 million.
Oh my land, that makes you give a heart attack.
When I saw the other day was 1.9.
Okay, thank you for clarifying that.
Sure. Oh, absolutely. Okay. So even though we had a poor cash month, the month prior to that. We actually saw a slight improvement. We actually collected $11,000 more than we collected in the month before. So, and we were down 200,000 from the month before, if I remember correctly. So all cash, our days cash on hand actually went up. The increase of the days cash on hand is a mathematical formula based on our daily expenses. So our expenses were down, so our cash on hand increased by 3 days. Does that make sense?
It does make sense, Tish, but that worries me that it's because the accounts payable isn't up to where it should be.
Right, if we hadn't put in the invoices from the state, after we took out all the Cardinal and the Keystone auto debits, we booked those bills in the AP, and then when they're taken from the bank account, we mark them paid. We do that so it provides a better audit trail, and that was discussed with the auditors. They would prefer to see it this way. So when you look at the AP, depending on what time of the month you look at it, those auto payments haven't come out of the bank. So they're still showing as debts that we owe, even though they're going to come out directly out of the bank. And they do average about 400,000 a month. And they come directly out of the bank account. Is that understandable?
Yeah. Yep.
It's a little convoluted, but that is how Cardinal mandates that we have that ability to buy the prescription, the drugs from them. They auto debit for everybody.
Okay, thank you.
You're welcome. So, accounts receivable, did increase. It didn't increase by much, but it did increase. It's not the trend we want to see. Our gross days are 49.3. The goal is at 45. The reason that was such a small increase is because we did write off accounts that were not billable. We had talked about it in the finance committee meeting that we had bills that we were going to write off that were not billable. Is that okay?
Yep, that's okay. So keep on going. We're all sitting there looking at the phone.
I'm so sorry. I really apologize. I heard it crackle and then it went, your microphone's no longer working. So as far as my CFO notes go, I probably need to change that to contractor notes, but ANOVA did start credentialing in early September, and all of the Epic software issues that we had have been addressed, and training has been completed. Processes have been reviewed and updated for greater efficiency going forward. The Medicare Railroad enrollment for all providers has been completed. We did release 11 months worth of health claims, and we should be seeing that payment pretty quick. Hopefully we won't get any denials for any reason. We haven't as of yet. Sage AP went live with submitting invoices to department managers directly from the accounting software. So we were able to eliminate using Adobe. Adobe charges us a monthly subscription for that use in AP, so we were able to eliminate that. It has had some glitches. I won't lie. It's had some problems, but we are continuing to work through them. And we have a ticket open with Sage as to the timeout. They go to the departments. If the department managers don't see them in a specific amount of time, they're going to Kathy as the default approver. I'm sure she'd like us to get that fixed. The final charge data master review has been received. I'm in the process of reviewing the suggested pricing and making updates to the new HCPCS codes and revenue codes. We found a few revenue codes that were not correct. When that initial review has been done, they will go out to the department managers, so they will have a copy of it. Then if they have any questions or feedback, that's the time when we'll ask for it. And then when everything is completed, the new charges will be uploaded into Epic.
Okay, thank you. Any questions?
No.
Ben has a question.
Well, I guess I'm just kind of confused. Well, I thought when are they going to start doing the accounts receivable?
So you're completely correct that the accounts receivable is cash collections is down. I'm not really sure where that up $11,000 went because it's down by a lot. And the ANOVA, the new ANOVA people, they started with credentialing, and they started on 9/22 with credentialing. They have a handle on that, and they have some old claims going out. They also started working on collecting accounts over 60 days old. They didn't focus on the current stuff. They started on 60 days old stuff, and they started that on 9/22. They have now transitioned to working on all collections as of 10/1. So at the very best, if you start on 10/1, you would see results like from Medicare around now, 10/15, 10/16, somewhere around there. But for them to really get ramped up, I would say by the end of this month, beginning of next month, we should see some real results from them. But the collections here in our facility are doing them alone, are getting worse. They were down like 200,000 from last month, and then they're down another 100 this month.
So that makes sense. I was thinking we would already see some results, but that makes sense. Okay.
Yeah, so we talked about that in finance, and the timelines match up. And from Kathy will talk to you a little bit about her goals and stuff, but her timeline in her mind of where we would start seeing results is, I think it's right on track.
Right.
She's nervous about it, but I
I'm
think
very
it's right
nervous
on
about it,
track.
yes.
From when they took over, we should start seeing, like we talked about, the fluff, the easy stuff that they started working on right at the beginning. We should start seeing that in another couple weeks.
Okay, cool. Thank you.
Okay, so Tish, you want to keep going on the profit and loss?
I'm done with the profit and loss.
Oh, I was looking at something else and.
I went through the narrative about the profit and loss.
Oh, okay.
So it's the same thing that the narrative is. It just reports what's on the actual financial reports if you don't want to look at the financial report.
Okay, so. So
you have questions?
I don't know if I have questions. Is there any?
You can always email me if you have any questions.
Okay. I'm just looking at. So then if you don't want to do, if we aren't going to go through the actual profit and loss statement, do we want to go through the cash flow?
Yeah, I would assume we would want to go through the cash flow.
Okay, well, let's go do that.
If you take your profit and loss, you can match it up to the narrative. The narrative is just
Right.
a more conversational way.
Yep, that makes sense. I see it. Yep. They do.
Sorry.
No, that's okay. It's just the difference of having you not in here in person.
I know, because usually I'm talking and flashing papers and making it a little more so where you can see it. So we've got the cash flow, and when we were, Cassie, did you pass out the corrected cash flows?
I did.
You did. Thank you very much. When we were in the finance committee, Ted noticed that there was an error in the money market totals. And I have to apologize. I did review it, but I was so focused on getting the expenses and the items below corrected that I didn't really I wasn't paying attention evidently. I just completely missed it. So we sent it out to Kathy. She printed it out and sent it out to you. So we removed some of the totals. So healthcare is difficult to understand, to wrap your head around the difference between revenue and cash. So revenue is what we log or record for the services that we've provided. So we have the potential to get that revenue less the contractual agreements. So, or the net revenue, that's what we should be collecting. That's the goal for what we should be collecting. So this sheet deals strictly with cash. So we've got the prior ending balances for the operating accounts, and that includes any account balance for the disbursement account, the care credit, the money, the merchant account, anything like that goes into the operating totals. That's where that number comes from. So what we can see, those are prior month balances. That's where I made the error. So Kathy corrected it for me and passed that out to you. So we've got the inflows, which is what's off of the bank statements. That's what we reconcile to on the general ledger every month. We show any increase or decrease from the last month. And as you can see, we had a decrease from the prior month of 31,000. We had salaries and benefits of 1.1 million. We had non-payroll related expenses of 1,056,000 for a total of 2.2 million in expenses, which is correct. We have increase, decrease last month versus current month. And you can see from our outflows, we had a decrease of 164,000. We had a decrease of cash inflows versus outflows. Does that make sense to everybody?
Yeah.
Kind of. Okay. Let me see where I was. So then we have the end of month for the operating account. Then we have the end of month for the money market account. We didn't take any money out of the money market account. We actually put money in. That's where all the donations went for the CT. We've got a couple of smaller donations for Mammo Month Girls Night Out that Keisha puts on every year. So we had 0 funds transferred out of the money market account. We have CD funds, they stay the same. That's the hospital CD fund, we don't touch that. Then we have, it shows you what our daily inflow is, which is our daily cash. Our daily outflow, which is our expenses divided by the days of the month. You can see it went from 77,000 the prior month to 74,000 in the month of September, which is why our cash on hand increased. And I'm removing some of the totals from the sheet as we discussed at the finance committee meeting.
So, does anybody have any other questions for Tish?
No, I mean, I think the big thing is that we definitely are being impacted by the fact that we're not getting our collections in like we need to, and our self-pay went up.